How do doctors determine whole brain death? Imagine a person who appears to be asleep but is actually beyond recovery. How do doctors confirm that all brain activity has truly stopped forever? That's what we're exploring today. Brain death, also called death by neurologic criteria, means the complete and irreversible loss of all functions of the entire brain, including the brainstem. This is a very important medical decision because it affects the patient's family and potential organ donation. Before starting any tests, doctors need to confirm that the brain injury is severe and permanent. Usually, this involves neuroimaging scans like CORT or MRI scans showing a catastrophic brain injury such as a stroke or traumatic injury. The injury must be irreversible and proven to cause permanent brain damage. Next, doctors must make sure that no other conditions are mimicking brain death. For example, drug overdoses, sedative medications, or severe hypothermia can look like brain death but are reversible. The patient's core body temperature must be at least 36 degrees Celsius or 96 degrees Fahrenheit. Blood pressure should be stable with systolic pressure above 90 millimeters of mercury, and oxygen levels must be adequate. Once these prerequisites are met, trained doctors perform a detailed clinical exam. They check if the patient is in a coma, meaning no response to pain or stimuli. They also look for the absence of all brainstem reflexes. These include pupils not reacting to light, no eye movement when the head is turned, no gag or cough reflex, and no facial movement in response to stimulation. For infants under 6 months, they also test sucking and rooting reflexes. All these reflexes must be absent for a brain death diagnosis. The most critical part is the apnea test. Doctors pre-oxygenate the patient and then disconnect the ventilator to see if the patient tries to breathe on their own. They monitor carbon dioxide levels and watch for any spontaneous breathing efforts. If the patient shows no respiratory movement for 10 minutes and the carbon dioxide rises above a certain level, the test is positive. This indicates no brainstem activity. If the patient does breathe spontaneously, the test is stopped, and brain death cannot be declared. Sometimes, if the clinical exam cannot be fully completed or is unsafe, doctors use additional tests called ancillary tests. These include special brain scans like transcranial Doppler ultrasonography or radionuclide scans that show no blood flow to the brain. These tests help confirm the absence of brain activity when needed. Timing and documentation are very important. Doctors need to observe the patient for a certain period, sometimes repeating tests, to confirm that the brain death is permanent. Every step and finding must be carefully recorded. If any test cannot be performed, the reason must be documented clearly. This process reflects core medical ethics principles. Respect for the patient and family is shown through clear communication. Accurate diagnosis benefits the patient and can allow for organ donation to help others. Standardized procedures ensure fairness and consistency in making this life and death decision. Determining whole brain death is a detailed, careful process that combines medical science with ethical responsibility. It marks the point where a person is considered legally and medically dead, guiding both patient care and organ donation procedures.